I'd like to start talking about trauma, because post-traumatic stress syndrome, the root of that is the trauma. Now what trauma is, it's an unexpected event. Two main things about trauma. One, it's unexpected. It's a surprise. We weren't thinking it was going to happen. It came out of the blue. It just hit us. That's part one. Part two is that the event is overwhelming. It overwhelms our psyche, our emotional system, our mental system. We're not able to fully process it. We're not able to fully handle it as it occurs. So what happens is that trauma and its overwhelming nature of that trauma goes into the psyche, into the unconscious. And the law of the unconscious is whatever goes into the unconscious part of our brain will return. And it returns, trauma returns in the form of symptoms. Symptoms are basically, if you look at the root of symptoms, S-Y-M, think of symbol, S-Y-M. Symptoms are symbolic of the original traumatic event. So what we see with symptoms is just traces, representatives of that original event. And with trauma, we call it post-traumatic stress syndrome. And I want to give you the three basic categories of symptoms that occur with post-traumatic stress syndrome. One, reenactment. The trauma gets reenacted. It's as if it was happening again, as if we were feeling it again, as if we have thoughts about it again, we have images about it again. That could be cued by something in the environment. If it was a car accident, let's say, that was our initial trauma. It might be seeing a car. It might be seeing a car spin out of control. It might be driving on a freeway with a car coming very close to us. That will cue us and stimulate our brains, which are very adaptive, and will recognize that that trauma is about to occur again. Now, the trauma may not occur again, but the psyche is very adaptive. It acts, it's prepared. When I said earlier that the two hallmarks of trauma are one, that it's unexpected, and two, it's overwhelming, well, think about it. We can't do anything, human beings can't do anything really, not much, about the unexpected nature of trauma. Traumas happen. They occur. What the psyche does to adapt to that is starts to prepare. We start to see danger even when it's not there. Our mind is preparing. What we want to do is, we don't want to be caught off guard again, so to speak. So we start preparing. We start seeing trauma where it is and where it isn't. There's a simple metaphor for that. It's called the snake and the stick. Now, normally, to survive in this world, we need to see a snake as a snake. If we see a snake as a stick, in other words, a harmless environmental event, then we will not survive. We need to see a snake as a snake and a stick as a stick. Once we've been traumatized, what we start to see is, we see a snake as a snake, we also start to see a stick as a snake. We're seeing snakes all over. That's how the mind adapts. It does not want to be caught off guard again. So it prepares. And in so preparing, we start reenacting our traumas, even when it's not so. That's the first category of symptoms, the reenactments. I said they occur through thoughts, images, feelings. They occur in dreams. They occur in flashback incidents. It's as if we're back in the trauma. That's why the first phase is the reenactment phase of that trauma. The second phase is hyperarousal. Hyperarousal means now our systems are geared up. Again, we're adapting. We don't want to be caught asleep at the wheel again. We adapt. And part of that adaptation is hyper-awareness, hyper-vigilance in our environment. We all check out our environments. This we do instinctively. Is it safe and danger? Safe and danger. We're doing this on an unconscious, sometimes conscious level, all the time. This comes with survival of the human being. We're always doing that. So once our system is geared up and we're in hyper-arousal state, we experience symptoms like high anxiety, difficulty concentration, difficulty focusing on one task at a time, difficulty falling asleep. Our system is hyped up, and that's the hyperarousal category of symptoms of post-traumatic stress. The third category actually follows from that, which is avoidance. Consciously, this usually is initiated consciously, this third category of symptoms. We don't want to experience the trauma again in a conscious way. So what we do is we start to avoid. We detach on a feeling level. People who've had serious trauma will not engage the world as much. Think about it. We've been out there in the world in some way and we were traumatized. We react by not wanting to be out in the world as much. That's why you see retreat from social activities, you see retreat from work activities, you see retreat from just being out in the world and engaging people. And along with that is this emotional numbness. Our feelings are kind of withdrawn. We become isolated. We also get a sense on a conscious level that people don't really understand. And in some ways, they don't. Even well-meaning loved ones might sympathize, might feel bad for us, might be comforting, which is all very helpful. But on the deepest level, when you've been traumatized, you often have the feeling that other people just don't quite get it. They don't quite understand what you've been through and the pain of that. And hence, we retreat more and more and can become isolated. And that's the third category of symptoms with post-traumatic stress.